And welcome back to the program. We are so very glad that you are joining us. And thank you, Martin, for that interview. We also wanted to get some information from people from other areas. And so Martin was able to talk with Dr. George Adams, a cardiologist from North Carolina, about his perspective on the conference and what it means to him. Martin?
All right, welcome back. So Bevy made sure she was going to bring us a physician from outside the area, and she brings us Dr. George Adams from North Carolina. Said he's a North Carolina State fan, and he has a lot of good teams to pick from, trust me. Doc, welcome to the program.
It is an absolute pleasure to be here.
All right, so you come in from the outside, and we're always curious, because we grow up in the same area as Dr. Walker and all these doctors. But what brings a guy from North Carolina to a convention in New Orleans like this?
You know, we treat the same type of population in North Carolina that you treat in New Orleans. You know, the patient population's getting older, they have diabetes, they got kidney dysfunction, and ultimately it leads to people who have vascular disease. You know, it's sort of like the plumbing in your house, right? If you get a blockage in one part of your plumbing, you can get a blockage in any part of your plumbing throughout the house. So what we try to do here and what we try to learn is how to prevent and treat stroke, how to prevent and treat heart attack, and how to prevent and treat people who have blockages in their legs, ultimately suffering from wounds. Ultimately, if we don't treat them effectively, they could lose their leg or their foot.
Let me ask you something, Dr. Adams, because when I started interviewing Dr. Walker, I was 25, he might have been 27. Veins were not a big part of our discussion. It was mostly blockages and open heart surgeries and different things. It's incredible how now veins may be the number one thing people are talking about.
You're absolutely right. If you think about it simplistically, arteries carry blood flow from the heart to the toes. Veins carry blood flow from the toes back to the heart. If you got a blockage in the hose going to your toes or a blockage in the hose going away from your toes, you got a problem. And either one of those can cause wounds. So you got to be able to treat both.
Yeah. The ambulatory clinics that we see now, I was sort of joking with Dr. Walker, but I guess I was joking, but I was half serious. We used to watch the Jetsons growing up, the cartoon that was futuristic. And everybody went, well, that's a little far-fetched. I don't know if it was. We are in the future now.
I think so. And, you know, one of the things that we've realized is COVID has made us change how we practice, right? And so you want to talk about the Jetsons? You know, imagine receiving medical care, looking into a TV and me treating you through a TV. And that's what it's gotten to. But hopefully we're getting back to our roots and we're going to be able to see each other, touch each other, etc. But you're right, the Jetsons are real. And technology and drugs are advancing, hopefully to help us treat this population.
You know what I often say, and I don't mind asking you, when you're talking about all these cardiologists who've gone to school forever, like, you know, you got to sort of leave your ego at the door, because you know when you walk in, you're going to be able to have a lot of feedback here, and you may say, well, I've never tried that. Or somebody talking to you may say, well, Dr. Adams, thank you for that. I've never tried that. If you learn and you listen, it helps.
That's right. And you know that saying, you see one, you do one, you teach one. You know, that's absolutely true. And if you never see it, you can never do it or teach it. So that's one of the nice things that Craig Walker has done with this conference. He's really brought in the best of the best so we can see different ways of tackling similar types of problems.
Right. What made you want to become a cardiologist?
It's a great question. So I worked on an ambulance back in the day. Before that, I worked on a farm raising cattle, tobacco, corn, potatoes, beans, just like most of us, but worked on the back of an ambulance, really liked working with people and enjoyed medicine, and then had the opportunity to go to medical school, and there she wrote.
So you worked on a tobacco farm?
I did.
Was it by Tobacco Road?
That is correct.
Yeah.
Yep.
So, and we all know basketball is big.
Absolutely.
Did you play basketball?
I mean, I played, but I didn't play with all the people that played at Duke and Chapel Hill and NC State. Grant, I love NC State. That '83 cardiac pack
Wow.
is amazing. But yeah, it's wonderful in that part of the country.
Yeah, can we go anywhere without saying Jimmy V?
Jimmy V. You know, we all loved him, and that SB speech he gave before he passed away was just outstanding. Remember, he said there are three things to live every day. If you laugh, if you bring yourself to thought. Imagine about thinking about one thing every day, laughing every day, and then something that brings you to tears. Those three things. So if you do those three things every day, you fulfilled your life, is what he was saying. It's just an incredible life.
Final question, because we have a little over a minute left in this segment. What advice for anybody watching? They may have swelling in their legs, they may have swelling in their ankles, they may be short of breath, they're always thinking the heart, but now they ought to get the legs checked.
Yeah, always make sure the physicians check your feet out, and particularly take your shoes off and your socks, make sure they see them. But the first thing is just realize there's help. Don't just think that just because everybody's got it, it's normal. If it's bothering you and you're losing ambulation, you aren't walking, you need to seek medical care.
Yeah. Doc, thank you so much.
Yeah.
North Carolina, man, right here. And of course, I'm a Michael Jordan fan.
Yes, sir.
So no doubt about it. We'll take a short break. We'll be back with a lot more right here from New Orleans, Louisiana. All right, you might have heard the great Cajun music in the background. Cajun and some Zydeco mixed in, and you might want to check out this website, Cajun Dupuis and the Cajun Troubadours. Hey, Grammy nominated. And we've been listening to them do sound checks and getting ready, and you probably heard some of this in the background. So go to the website, help them out. Two great, it's a father-son duo, and they're doing a great job. Local musicians doing well. So go, and you might want to purchase one of their CDs, keep them rolling, keep them playing local music here in the area.